Hello everyone, this is Group20 and our topic is about in-depth analysis of painkilling medication on human body. Our presentation will be divided into 4 different parts, which are introduction, pharmacology, pros and cons, and conclusion. First, my groupmate Frankie would introduce what is painkilling medication to you.
Hello, I'm Frankie, and now I will introduce what painkillers are. Painkillers are drugs that suppress pain in the human body when used properly, and therefore it's very important to use these correctly. Analgesics has been classified into mild, moderate, and severe pain, and painkillers are used in mild pain. In this essay, we will introduce aspirin and ibuprofen and compare them. These two painkillers are very common and are both non-steroidal anti-inflammatory drugs, which is NSAIDs in short. From this, we will learn how these painkillers act on the human body. The chemical name of aspirin is acetylsalicylic acid, which is ASA in short. It has the effect of reducing pain, fever, inflammation, and inhibiting the formation of blood clots. So the origin of aspirin is found in the willow tree. In 1853, Charles Frederick Gerhardt succeeded in producing ASA using sodium silicate and acetyl chloride. In 1897, Bayer started to investigate a better replacement and ended up finding an alternative method to synthesize it. Bayer got the right to name it, and he named it aspirin and sold this drug globally. Aspirin is one of the unique drugs as it is the most known painkiller, with around 40,000 tons used globally. It is one of the essential medicines required by the World Health Organization. As for ibuprofen, it comes with many brand names, such as Motrin and Ethyl. It has the effect of relieving pain, reducing fever, and inflammation. It was first discovered in 1961 by Stewart Adams and John Nicholson, and it was provided to the public for people to use it in 1969. These are some speciality of ibuprofen. Ibuprofen is unique as it is a weaker anti-inflammatory agent compared to other NSAIDs. It is available as a generic medication for patients and is a common painkiller, with more than 16 million prescriptions in the USA in 2020.
Hi everyone, before analyzing aspirin pharmacology, I'd like to talk about the journey through human body of those painkillers. I mean, aspirin and ibuprofen. Imagine you just swallow a painkiller tablet. It will go on a journey through your digestive system and will travel down your esophagus and arrive at the stomach, where it is dissolved into much smaller particles. In small intestine, those small particles will be absorbed into the blood so that they could be effective in appropriate places in human body. Then we move on to the introduction to aspirin pharmacology, and I divide it into 2 parts. First one is chemical properties. The second one and the highlight is mechanism of action. And here is the structure formula for aspirin. Let's start the first part, chemical properties of aspirin. We can see the formula of aspirin synthesis. This hydrogen atom reacts with the acetyl group and form base. Aspirin is an NSAID drug. It is stable in dry air but gradually hydrolyzes in contact with moisture. Learning the chemical structure, then we move on to the core in my sharing, aspirin mechanism of action. Unlike other NSAIDs, aspirin irreversibly inhibits COX enzymes by acetylation. And let's see how other enzymes combine with COX enzymes. Other enzymes just compete with the normal substrate for access to active sites. So if drug is cleared from the active sites, then the substrate can bind once more. Then we focus on aspirin unique mechanism of action. Aspirin inhibits COX-1 and COX-2 enzymes permanently by acetylation and irreversibly blocking their activities. Here is the process of acetylation. And to be specific, aspirin acetylates serine 529 in COX-1 and serine 516 in COX-2. In this diagram representing plasma concentrations changing over time, we can see the half-life time is no longer than 2 hours. However, aspirin affects human body for nearly 10 days. So why the duration of effects of aspirin is much longer than the time aspirin remaining in the blood? As we mentioned, aspirin alters the structure of COX enzymes, leading to the decline of prostaglandin. For platelets cannot produce new COX enzymes, the effects of aspirin could maintain for a long time until COX activity recovers as a function of platelets turnover. Here is how COX genes control the synthesis of COX enzymes, which are catalysts in the reaction of arachidonic acids turn into PGH2. Aspirin influences the catalysis of OATs by altering the structure of active sites in COX-1 and COX-2, as we mentioned before. This slide presents the process how arachidonic acid forms those pro-inflammatory prostaglandins under the catalysis of COX-1 and COX-2. And as we mentioned before, aspirin blocks those COX enzymes activities so that it can inhibit synthesis of those pro-inflammatory prostaglandins. Then comes to our desired effects, relieving the pain. And that's all for my sharing. Then pass it to my partner for the introduction of ibuprofen pharmacology.
Our group may just talk about the usual mechanism behind aspirin, right? So why not we sort of talk about the mechanism behind ibuprofen now and the pharmacokinetics behind it. So what exactly is ibuprofen? Well, ibuprofen is a type of non-selective NSAIDs, which is a non-steroidal anti-inflammatory drug. It's usually available in tablet form, and these two, Advil and this Japanese brand, these two are the more commonly used brands for ibuprofen. So what exactly is the mechanism of action behind ibuprofen now? So ibuprofen, unlike aspirin, where it's a complete inhibitor of the COX-1 and COX-2 enzymes, ibuprofen is a competitive inhibitor of COX-1 and COX-2 enzyme, meaning what? Well, you look at the chemical structure of ibuprofen over here. You see that there is, at the carboxyl group, there is a C double bonded to O, that's a carbonyl group. The oxygen of the carbonyl group would bind the nitrogen atom of the active site of the COX-1 or COX-2 enzyme, which would temporarily inhibit the functionality of the active site of the COX-1 and COX-2 enzyme, right? So what does this do? This prevents the actual substrate molecule, the arachidonic acid, from binding to the COX-1 and COX-2 enzyme and preventing the catalysis of arachidonic acid into prostaglandin, which would cause decrease in pain and inflammation level. So what exactly it's prostaglandins? Why does a decrease in prostaglandin level would cause a decrease in pain level? Well, using prostaglandins and other pro-inflammatory molecules that are produced by COX-1, such as thromboxane, they are precursors to actual pro-inflammatory molecules such as histamine. So what prostaglandins do is that after secretion of prostaglandin through the catalysis of arachidonic acid, these prostaglandins would stimulate mast cells, as you have shown in the picture of it. They would stimulate mast cells, the mast cells after stimulation would produce histamine, which would produce the four sort of main symptoms for inflammation, which is redness, pain, swelling, and also heat, essentially. Most notably, it's PGE2 from COX-1 that causes this sort of inflammation. And with the inhibition of COX-1, it inhibits the overall overall catalysis of arachidonic acid, right? But it also reduces the amount of inflammation and reduces the amount of pain a person may feel. So there's also like multiple sort of drug delivery forms that ibuprofen can take, right? There's tablets or syrup or suppositories even, but they only exist in Europe. So for tablets and syrup, most of the time what pharmacists or doctors would do is that they would include sort of glucose powder or maltodextrose powder in or like a glucose solution into the syrup as well. So it would sort of provide a taste masking property to this tablet or drugs to make sure that it's easier for not just adults but also for kids to ingest and also ingest them into it. Also, it's worth noting that tablets and syrup it's also better to like adults to take in a tablet and syrup instead of suppositories because ibuprofen is shown to have a higher bioavailability when it's absorbed into the GI tract rather than in the intestinal tract. So there is a potential side effect that a lot of people may talk about when talking about ibuprofen is that gastrointestinal injury because NSAID would inadvertently non-selectively inhibit both COX-1 and COX-2 enzyme, in which the inhibition of COX-1 enzyme would cause a decrease in mucus secretion from the stomach, right? This would cause stomach ulcers to happen due to the corrosion that hydrochloric acid in the stomach would cause, right? This, although it's true, the thing is that because ibuprofen has a drug half-life of around 1.7 to 3.4 hours, it's usually unlikely that taken at a recommended dose, it would actually cause stomach ulcers with this sort of short half-life. In addition, only 10-12 cases exist per year among the millions of ibuprofen users, so it's usually not a side effect that is worth mentioning. So let's move on to my other group mates part about the pros and cons on ibuprofen and aspirin.
Hello, I'm Fazia, and I'll deliver the presentation from Toast. I would like to introduce the pros and cons of aspirin to you. First, aspirin would be absorbed rapidly by passive diffusion from the stomach and upper small intestine, which are as shown on the picture, the stomach and the upper blue one. As suggested by Patrono, the high absorption rate of aspirin results in a measurable inhibition of platelet function within 60 minutes, which could indicate that aspirin could be absorbed rapidly. Another unique benefit of aspirin is that it can reduce the risk of cardiovascular disease. Atherosclerosis is the major cause of cardiovascular disease, which could thinning the arteries as shown on the picture and might lead to a reduction in the blood flow to the tissue and organs. Through targeting the body's smallest blood cell called platelets, aspirin diminishes the ability of blood to clump together into clots. However, there may be some risks for taking the long-term aspirin since it will cause other problems like bleeding. So before taking daily aspirin, the net benefit of it should be considered. After discussing with you about the benefits of aspirin, I would like to share you with the cons of it. To begin with, aspirin is not suitable enough for all people, like I list on the slide. Also, aspirin might interact with other drugs and foods. Drug-to-drug interaction occur when one drug affects the activity of another, leading to some unexpected effects or more severe effects. And drug-to-drug interaction may result in one or both of drugs do not achieve the expected effect. Here I list some examples of drugs that aspirin possibly interact with. In addition, aspirin could also interact with alcohol, which would cause the higher risk of bleeding in the stomach. So it's essential to consult doctor for advice before taking aspirin with other drugs. Also, do not drink alcohol. And here are a list of other common side effects caused by aspirin. And then my group mate would introduce the pros and cons of ibuprofen to you.
Hello, it's Ken. For ibuprofen, there are three main points: high absorption rate, prevention of breast cancer and Parkinson's disease, and lower serum half-life. First, is well shorter overly, and the patient consultation can be attended in 1 to 2 hours after extravascular administration. Also, there is not influence in the extent of the absorption after a meal, only a slight change in the absorption rate. The range of absorption is very high when compared to other non-steroidal anti-inflammatory drugs. Although it is lower than aspirin, moreover, it has a higher clearance range of 3 to 13 liters per hour. And OTA or with below impairment do not affect the elimination of ibuprofen. Then it can reduce neurodegeneration and help for prevent Parkinson's disease because this can inhibit inflammation and oxidative stress, which are correlative mechanism of Parkinson's disease. Also, several studies have shown that regular intake of this drug can reduce incidence of breast cancer by about 15%. Next, the C1 half-life is 1.2 to 2 hours. There has a stable event in 1 to 2 hours. Besides, the compromised liver doesn't affect the function too much. And then there are some other points to ibuprofen. Okay, let's move about cons of ibuprofen. There are 2 main cons. About cannot use before or after a coronary artery bypass grafts, and pregnant women, they are not suitable to use the drugs. And when they take the drug, they will have a serious side effect. Thirdly, their positive side effect is constipation, teariness, gas or bloating, nervousness, and ringing in the ears. And then my other group member, Lizzie, will tell you more about discussion.
Now I will tell about our discussion. In our discussion, we divide it into 2 major aspects of comparison, including the similarity and differences between the 2 drugs. The similarity are divided into drug categories and approximate effectiveness. The differences are divided into drug ingredient and side effects. Our summary is that each the 2 drugs has its own advantages. Among the similarities, first, the drug categories of drugs are non-steroidal, anti-inflammatory drugs. Secondly, the approximate effectiveness of both drugs includes treating pain, inflammation, and fever. And aspirin can act as an anti-thrombotic agent. In terms of differences, first, in terms of drug ingredients, aspirin is propionic acid, while ibuprofen is salicylic acid. Secondly, in terms of side effects, there is about the risk of side effects in some people. Aspirin is associated with kidney problems, peptic or severe gastritis, and a higher risk of bleeding, while ibuprofen are associated with cardiovascular disease, peptic, severe gastritis, and kidney problems. Finally, in our summary, each of 2 drugs short-term medication to treat pain and inflammation. So, each of the 2 drugs is taken as directive and should not be taken long-term, as it can cause serious side effects. That is the end of our presentation. Thank you.